So Clay here again, coming to you with a 63-year-old female with high blood pressure. So going over our steps, first looking at rate, so using the big box method, 300, 150, 100, so a little bit less than 100, so about 98 beats per minute, so borderline tachycardia, but normal. Then taking a look at rhythm, you see a P wave, you see elongated PR intervals, we'll get to those in a minute, a narrow complex QRS, P wave, QRS, P wave, QRS. So you have P waves before each QRS, so normal sinus rhythm. Then taking a look at access, so looking at one, looking at AVF. One is positive deflection, AVS negative deflection, so still a left axis deviation. And then back to that PR interval that I had looked at before. A normal PR interval is between 0.12 and 0.2 seconds, and anything exceeding 0.2 seconds identifies the presence of a first-degree AV block. So as you can see here, we have over the 0.2, so an AV block happening in this patient. And then taking a look at, since there is the history of the high blood pressure, possible some left ventricular hypertrophy, and there's numerous ways to see left ventricular hypertrophy on an EKG. So you can see the R wave in lead AVL is greater than the 12 millimeters, which is consistent and highly specific for the diagnosis of left ventricular hypertrophy. The specificity of this finding, as I said, is high, but despite this high specificity, there's only about 10 to 15 patients with proven LVH that meet this criteria. So while when you see it, you probably have LVH. Just because you don't see it doesn't necessarily mean you don't have LVH. So, and the other message, you can take a look at lead 1, and anything greater than 14 millimeters can suspect you of LVH. And then if you look at the R wave in AVL, as you see here, and you add that to the S wave in V3, as you see here, if that number is greater than 20 millimeters, it's a high suspicion of the left ventricular hypertrophy. And besides that, you can see some abnormalities of ST segments. You can see some slurring here as in V2 as well as V3. And when you did a further workup of these patients on like a stress test, this slurring can possibly give you a high false positive exercise treadmill EKG test and would most likely need some further evaluation of these strain patterns. So just to recap, see the elongated PR interval greater than 0.2, suspect a first degree AV block. Notice increased QRS segments, the height of the QRS segment, suspecting LVH, expecting left ventricular hypertrophy, LVH, and a high clinical suspicion because you have a patient with long-standing high blood pressure. So, thank you, and that is it.